In the last 10 days, India reported its first case of monkeypox. WHO declared the viral infection as a public health emergency of international concern. As of last week of July, monkeypox has affected over 16,000 people in 75 countries and counting, way out of Western and Central Africa where it is endemic to the region. To control the spread of the virus, it is essential to know the answer to this one question. What is the route of transmission? The answer to this question has become a bone of contention within the medical community.
The moment we say it is like spreading through respiratory infection, it is spreading through fomites, through towels, household industry, housekeeping industry, then we are beating around the bush. We are not talking spade is a spade.
First, there's no need to panic, as monkeypox is not as infectious or nearly as fatal as COVID-19. According to WHO, the monkeypox virus belongs to the same family as smallpox virus, and vaccines against smallpox are 85% effective in preventing monkeypox. India declared itself as smallpox free in 1979, and so vaccination was halted too. So anyone who was born after 79 may be especially vulnerable, apart from the usual vulnerable groups like immunocompromised individuals and children. The symptoms are more or less similar to smallpox: fever, lesions, swelling of lymph nodes. So this much we know, but there's a lot we do not know, especially about transmission routes. Right now, the guidelines for management of monkeypox by the Ministry of Health and Family Welfare in India is based on WHO's recommendations. Equal weight is given to different forms of transmission routes such as close contact with respiratory secretions, skin lesions of infected persons, or contaminated objects like bedding for prolonged time. Yet, there are some doubts. According to a new study published in New England Journal of Medicine on July 21st, of the 528 infections diagnosed between April 27 and June 24th at 43 sites in 16 countries, in over 95% of the people, the transmission route is suspected to be close sexual contact. But WHO says it is unclear whether monkeypox virus is spread specifically through sexual transmission routes. At the same time, WHO Director General Dr. Tedros has said that the infection is concentrated in the MSM community. Many experts are even asking that monkeypox be declared a sexually transmitted infection.
It is like spreading through respiratory infection, it is spreading through fomites, through towels, household industry, housekeeping industry, then we are beating around the bush. We are not talking spade is a spade. And when you say it is STD, when it is spreading in 20 to 45 age group, when it is spreading in MSM population or people having multiple sexual partners, then our target is different. You first accept STD, then you can say that accidental transmission is possible by this way. But currently what you are doing, you are making accidental transmission more prominent, hiding sexual transmission. So I think we should decide our population where we want to have a target. And that can be done only if you decide whether it is a STD or non-STD.
Dr. Gilada is for declaring monkeypox as an STD. In fact, the same study that I spoke of earlier also says that over 98% of the infected were gay or bisexual men and 41% were HIV positive. But once monkeypox is declared as an STD, there will be one more problem of stigma. Already a case has been reported from Kerala's Alappuzha where homophobic posters have come up targeting the LGBTQIA community in the name of spreading awareness about monkeypox.
So we should have a stigma and discrimination prevention right from the beginning. We cannot shy away from a problem. Yeah, WHO may have compulsions. They may be bothered and scared about the backlash from the community, but convince the community. If you convince the community, I don't think there will be backlash from community. If your approach is non-discriminatory, non-stigmatizing, they will accept you. You tell them this is because of this factor like this. So if you at all you want to indulge, these are the preventive factors.
India is experienced in fighting against a sexually transmitted infection like HIV, which has been on a downward trend after hitting the peak in 2000. It might have some lessons for us.
Once you have a target population ready, then you have agencies to look after. For example, in India, National AIDS Control Organization, NACO, they have been existing for last almost 30 years now. Since 1992, they started. In 30 years, they have tentacles all over the country. They are close to 2,100 ICTC, called Integrated Counseling Testing Center. There are more than 1,000 ART centers. And they are having a partnership with all communities like MSM community, Humsafar Trust, a lot of other trusts are there. There are communities of hijras, there are communities of sex workers. They are partnering with them. So target will be very easy. They will be reaching out to them. They will incorporate just monkeypox to their existing target of whatever disease prevention they are doing. So we should do that. We are not doing that.
For all this to happen, monkeypox should be declared as an STD first. What do you think? Is it time to declare it as one? Or do you feel we need to wait more? Let us know your thoughts in the comment section.